Go for it.
All right. So I'm Ginger Conley. I'm from the West Virginia School of Osteopathic Medicine. I'm a student counselor and learning specialist. And Carolyn asked me to present this anonymous case that was sent to the ECHO project. So what we have here is, the questions on the table are, what happens when a student comes with mental health concerns and just disrupting the greater community on the campus? And when a student turns from a hospital with an aftercare plan and is not attending those sessions and kind of causing some behavioral, like how do you know the difference between a mental health concern, behavioral disruption concern? So our student here is a male student athlete, prominent team member, brought to the counseling center with suicidal ideation that he expressed to the coach. Coach handed him off. The student expressed in the meeting with the counselor a desire to get brain evaluation, concerns about concussions, and also upon counselor assessment, expressed he was not feeling suicidal and didn't seem to be at risk. So student went back to practice, and in the next 2 weeks, there were other concerns that came up. The ex-girlfriend expressed concerns about him being suicidal. I got lost there, hold on. He locked himself in his room. 5 friends attempted to get him out. He refused, expressing, suicidal, statements like life is not worth it, called security, assessed for suicidal ideation, and was sent to the hospital for evaluation. Was released within 24 hours. Parents were upset that their son was sent to a hospital, and then ended up with a case manager where the care plan was to continue seeking counseling services. The student came to a couple sessions, missed sessions, and then was reported, the ex-girlfriend reported that he was harassing her, following her, and then, lots of stuff. So let me see, can you scroll on down? So Title IX was involved. Parents accused the school of discrimination for mental health concerns, and the student continued to miss the counseling sessions that were planned by the care manager. A lot of people involved on this case: the dean, threat assessment team, counseling center, residence life, security, coaches, athletic directors. So that's the gist of this case presentation. And the things that have been done. The student was able to finish out the semester with a behavioral agreement that he wouldn't contact the ex and go to counseling. The student failed the semester and was suspended, and then he appealed and was allowed to return on academic probation. So when everybody got that? Everybody got the case? So if we could go to the slide that I made, Jay, do you have that?
Dude, I do not have that. That's from last time. Hold on 1 second.
Okay. There we go. All right. So when I first read the case, it just my brain automatically jumped to policy. And just as a to make everyone aware, I do work at the Osteopathic School of Medicine. So we have a little bit different approach, I think, in boarding students on what's kind of required of them. And they have a document that they have to sign. That's the WVSOM Health and Technical Standards, that they are agreeing to, a certain level of health and wellness standards. And so I pulled an excerpt in the green box that just for you guys to look at, our students have signed an agreement that says our behavioral and social attributes and what they're agreeing to, as well as, emotional wellness and attributes. So that's kind of the excerpt from the technical standards that seems relevant to this case. And then I've also added in the yellow boxes our institutional policies. So like I said, when I saw this case, I was like, ooh, like this is where I'd really want to refer to our policy. And because everybody in this situation is involved up to the dean, this is where we'd be really working here as a team to figure out what's the best plan for the student. And because we have these policies, so on the left, we've got policies about students taking leave for mental health concerns, so they can refer themselves, or our dean has the authority to remove the student from educational activities if they seem like they're not able to do that. We have our medical leave policies. So if a student leaves for medical health reasons, then the dean needs that in writing from a healthcare provider that they're healthy to come back. And they also, we have certain standards of the student having to comply with treatment. So the way that might work here is if the dean has mandated a student to get help, then we, from the counseling center, we don't tell them like how the counseling is going or anything like that, but we will confirm, yes, they're following through with those appointments, which gives us a little bit, I think, of a basis for intervention. So I just wanted to share that because I thought for the discussion today, it could be helpful to really have everybody think about and talk about the policies at each of your institutions. And are there policies? Like, should there be policies? Like, getting just the discussion going of how to really address and intervene on situations like this. Because when I read it, I was like, oh, like, I feel pretty, grateful that we have the systems and policies in place here that kind of know what steps to take. And we work as a close team here to take care of the students in situations like this. So discussion questions, like I said, what policies does your institution have? Does it need policies? What are the pros and cons of pursuing an involuntary leave for a student? We all know that's a difficult position. And then even though the student was denying suicidal ideation to all the right people, like all the people, the mental health professionals, is there enough evidence here to substantiate that administrative action like that's in our policy for that administrative leave? So those are my discussion questions for the group.
Thank you, Ginger. Really appreciate that. So what we can do now is, let me check the chat just real quick, make sure there weren't any questions in there. Looks like people are just putting their info in, which is great. We will go ahead and separate into breakout rooms like we did last time. There will be one room that'll go off the main room, and the main room will stay. So I'll just divide everybody up, and Carolyn will lead the breakout room, help facilitate that. And then I will stay in the main room. So give me 1 second to put everybody in, and we'll go. We'll give everybody 15 minutes. And in the meantime, I've put a message out to our presenter, our didactic presenter, to see what's going on. She is a therapist, so something might have happened that we don't know, but I'll keep checking on that as well. But thank you again, Ginger. So give me 1 second here. right, and here we go. Okay, we think it worked this time. So hopefully there will be some actual recording to the to this session, as unlike last time where it was nothingness. So Ginger, I'll turn it back over to you to help lead. I know you have your discussion questions. I can bring those back up if the group would like, or we can just, start talking about it.
So any thoughts, anything come up for anybody, or anybody have any kind of similar experiences or use of policy like I've presented? Oh, can't hear you, Lisa.
Yep. Okay, my name is Lisa, and I'm at West Liberty University.
Mm-hmm.
And we don't have policy for leaves. Fortunately, we haven't run into any problems, but we have had the experience of a parent being upset because the student was taken to the emergency room. So it makes me wonder, yeah, should we have policy? We don't. Communication is good on campus. I'll inform our Dean of Student Affairs if there's a situation, that I feel like the counseling center is having trouble resolving. But yeah, we don't have policy.
Mm-hmm.
Hi, I'm Sean McRoy. I would like to ask, with the signing of the paper, that's like a contract between the student and the school system, right? So, I mean, if they're breaking that, I mean, you definitely have legality to help the student in a crisis situation. And if that involves taking them to a facility, I mean, the parents are upset and stuff, but I mean, there's really nothing that they could do because you're going to fall back on school policy and that signed paper, correct?
Mm-hmm. Yeah, that's the situation for our school, which we find lots of comfort in, because it's like you've made this agreement, and a lot of times that's referenced in any meetings that may be happening with administration. For this, I don't know what school it is that the case study is on, and if they had that available to them. It sounds to me like there was some gaps in how to have that wraparound intervention to really support the student. So that's why I thought about our policies and presenting that as a juxtaposition.
The other thing I forgot to mention is if we have a student that's at risk, we do have the behavior intervention team. So that student is discussed among that team with interventions, again, to wrap around resources for that student. And we do have a contract that student signs whenever there's a referral. And so we can't necessarily mandate counseling, but we will mandate a risk assessment. So that student would be meeting with a counselor at least for 4 risk assessments, and then we'll do a recommendation from there, whether to continue in counseling or whatever the recommendation might be. So we do use the BIT team.
Yeah.
I guess, so I'm Juliana. I work with Ginger. I'm lucky to get to work with her. And, I think one thing, besides the health and technical standards form that they have to sign, it's really helpful to have the policies so that you can fall back on that. And I think that can be true for any institution. One thing I want to say about that, though, is it's important that the people providing the support and the help, whether that's the counselors, whether that's the BIT team members, have a say, like are part of that process of developing those policies. Because I can tell you, Like we have had policy, like our student mental health policy has been revised over the years, and I can tell you before how the policy was written, it just wasn't practical, right? In terms of what actually happens in your office, right? Like if you're a counselor, you're doing that risk assessment and you often have to act really quickly. Like you don't have time to have your administrator fill out some form, which was the deal for when with the old policy. So I think I mean, that's the only thing I want to say is that policies are important because it definitely, when parents are upset, we can say like, this is how our school handles these types of situations, and you can fall back on that. But I also think it's important that the people that are carrying out the policy have a say in how it's developed.
To add to that, do you guys have a particular time frame to look at and reevaluate every so many years to look at that policy? Because an update happens, it might be a new administration that comes in waiting for that update, and that might be a very long period of time before that. Do you reevaluate every 3 to 5 years?
I don't think it's actually, and Ginger, you correct me if I'm wrong, but I don't think there's an actual schedule of how often we review that. Typically, policies get changed when there's a problem or there's new information.
Yeah, I was going to say it gets reevaluated when the situations come up, or we get to test it out. And so the one that we currently have, I think, works pretty well. You know, Juliana and myself and our other team member here have had the experience of having to step through these with the administration with student issues. And it seems like it's doing pretty well for us, what we set it on at this point. I also, you know, I think one of the other questions that I put in the discussion was just about, I think sometimes and I know I've had this experience where it feels like the student might need involuntary leave, and how do you know when you have the evidence for that, or can kind of make that move, and when's that a good move? And I think in my impression from reading this case was they have enough evidence. Like they should probably do something, and it would probably have served the student better to have had an involuntary intervention, because it doesn't sound like he was well. And sometimes it's hard to make those decisions, especially it sounds like he was involved in the team. And there was a lot of importance there. We have that experience because if our students have a problem, they have to repeat the entire year. The way the medical curriculum works, if they have a bad week, it could mean that they have to do a whole additional redo of the entire curriculum for 1 year. So there's a lot of high stakes experiences of like, I don't need medical leave, even though they're really compromised, and depression in particular, like can't make that decision for themselves. So I thought we could maybe shift to that question of when do you make that decision? What are people's experiences with that?
This is Kurt with West University of Parkersburg. We being a community college, non-residential, don't have to deal with the issues that you do. And thank my higher power for that. But I do think that based upon what you shared, it is important where the big team would be a part of that decision-making process, since it does have such a significant impact on that individual. It's nothing to go to a course again or go to a semester for the entire year. You're right, the stakes are very high compared to what we have at community college.
Mm-hmm.
I think it needs to be evaluated as not just the individual, but the people surrounding that situation. Because you mentioned the ex-girlfriend and the current girlfriend and 5 other students on the sports team. Like their input has to count for something when evaluating this, because he's not just in a situation of himself, he's also in a situation of everybody around him. And I'm also at a community college too, and like you don't get to know people as in depth at the community college maybe as you might in a high-end university where you're more pushed together and a bunch more people in a room and working together in a different system. We do a lot of online classes, so you have an individual that might only see somebody through a screen, through that time frame.
Hello, everyone.
Hi.
Hey, Brandy, thanks for. We're just going over the case right now. So we just flip flop. So no worries at all. We understand things come up. So we hope everything's all good. So just give us a couple more minutes. We'll be wrapping up here, and then we'll switch gears and get you started.
Okay, thank you all too. Thank you so much. I had an incident I had to see about a student. Thank you.
Yeah, as soon as our kind of antenna perked up when it got a little bit after, we're like, something's not right here. So no worries at all.
Okay. Thank you. Okay.
I guess I have a question for the group in terms of the BIT team agreement. Like when you create those agreements of how, like what needs to happen with the student, what happens if the student isn't following the agreement? Like what happens next? Like maybe they didn't show up for that threat, like evaluation or so forth.
Yeah, well, for West Liberty, unfortunately, we can't do any kind of like conduct or consequence. We just try to wrap as many services around them as we can that they would be willing to do. But again, we do mandate the 4 risk assessments. And if they don't follow through with those, then the behavior intervention team again would pull back together and discuss what direction we want to go. So, it'd be very individualized, but I mean, we can't consequence them in any way. So we just keep trying to reach out and wrap as many services around them. So sometimes it might be housing staff checking in on them, campus police doing wellness checks, coaches, trainers.
Yeah. Got it.
Any other comments or questions as we wrap up here?
I
Yeah,
have a
Sean.
question for Lisa.
Mhm.
Because you don't have that system in place, does it seem like the turnaround on that is maybe disorganized or takes a long time to get through? Because if you have a coach checking in on when does the coach contact the group to say, this is what I see in the player, or if you have like the housing department going to check in on the student for a wellness check, or campus security saying, hey, I have this person telling me that they're being followed by this other individual, like how long is the recycle to get back to?
Well, on the behavior team, we do have like campus police, someone from housing, someone from athletics. So the communication is pretty good as far as getting back. If there's any concerns before we would meet again, then they would let me know. And then again, we would just keep trying to reach out to the student and try to get them in for an in-person. Fortunately, things have gone really well and the students are willing to come in and to share their side of the story. So that's what we do. The other thing is in our privacy practices that the students sign at their initial counseling appointment has information in there also about, any concern for their risk and that might result in contacting their parents even without their consent. Or maybe a referral for an ER evaluation. So that is in our privacy practices, but we don't necessarily have a mental health policy.
Awesome. Well, guys, great job with the discussion. Ginger, great job with the case. Hopefully this was helpful. We'll go ahead and bring everybody back in to the main room here and switch gears, but really appreciate everybody having the discussion. This was great. Okay, give me 1 second here. And looks like We'll be bringing people back any minute. Here we go. Okay. All right, looks like everybody's back in the main room here. Carolyn, how did it go?
Pretty good. I think we had a good discussion. Do I have a minute to just hit a couple of our
Absolutely.
highlights?
Yeah, do it. Yeah.
So a couple of things the group brought up were thinking about all of the different resources that were checked off that they had accessed, didn't seem to check off disability resources. And so the group was interested in what that, department could have brought to the table for this case. We were interested in the evaluation for concussion or TBI and talked a little bit about that and just risk factors and behaviors associated with brain injury for athletes. We talked a little bit about the different types of schools we had in our group and what types of policies. So some schools have no medical leave of absence policy. And so, that's going to be a really different discussion than schools that have more policies in place around mental health leave of absence or medical leave of absence. We picked up on, it seemed like in the case that they were really making a plan for the student rather than with the student. So we kind of picked up on talking a little bit about that and talked about when a student comes in feeling very overwhelmed, involving them in that plan can help give that student more of a sense of agency over their own life and health and future and academics. And then we also had a resource shared, the Hidden Opponents, which is a national organization that has chapters on different campuses with resources to help reduce stigma around mental health in athletes.
That's great. Thanks, Carolyn. I would say the discussion was very robust in the main room as well. A lot of talk around policies. Do we have them? Do we not? What are the differences in some of their policies? They might not have a behavioral health or mental health policy, but there are some things in their other existing policies that cover some of those items that were discussed in the case. So just a lot of discussion around kind of the team and the resources. I think, Lisa, you brought up that you have a lot of different, it's a multidisciplinary team for your behavioral health team. So how do they all interact in the communication between them? So there was a lot of variation, just like Carolyn, just like you were saying around the group about what's available, what's not available, or how they do things. I don't know, anybody else in the main room, if they want to comment, please go ahead. Okay. Well, thank you guys for doing that. Hopefully that went well, a little bit smoother on the recording as well. And we'll turn it over now to Brandy Anderson. So Brandy, thank you again. Hopefully you're settled in now after everything that's gone on. So you can go out, you should have access to share your screen and do the talk. So just whenever you're ready, go for it. And we'll take questions at the end.
Okay. Okay. Hi, everyone. I just want to say thank you so much for allowing me to be here today. I'm going to try to get through this in a timely manner because I know I came a little bit late, but I just want to thank you all so much. For those who don't know, I'm the lead clinician over here at Healthy Minds University. And so we work with students who attend WVU. And so we had a student in crisis and had to transport that individual to the hospital right before the presentation. So again, I apologize, but thank you so much for allowing me to be here anyway. So today I'm going to be talking about best practices when working with the Gen Z population. And I know a lot of you are obviously experts in your own regard. So some of this will be a little bit of a review, but this is what I have to share. So let's get started. So when it comes to Generation Z, you know, obviously they've been front and center to a lot of our tragic and really crazy, you know, events that we've had, you know, in our society in these last few years. For instance, a lot of political unrest, social unrest, you know, murders and things like that, not to mention the tragedies within schools, outside of schools, and, you know, last but definitely not least, the pandemic. And so when we think about the implications that COVID-19 has brought about when it comes to this generation, it's really impacted them in a lot of different ways. For instance, 68% of Gen Zers feel that the pandemic has negatively impacted their mental health. 1 in 4 individuals actually were diagnosed with a condition during that time. And fast forward, you know, now that we are, I guess you can kind of say maybe past the pandemic, maybe not though. I'm still seeing a lot of people, you know, getting COVID still. So are we really past it? I don't know. But fast forward to now, almost half of individuals are diagnosed with a mental health condition in terms of the Gen Z population. So really very high, you know, and raising numbers in terms of this population. And so we at Healthy Minds University deal with a lot of individuals who kind of fit these categories. I also wanted to just highlight the fact that Gen Z pays an average of like $44 a month for medications, and that's not even including like co-pays and things for actual mental health appointments. So not only, you know, does it have mental and, you know, physical implications, but also has financial implications that are causing these students a lot of stress and things like that. So that's always something to definitely keep in mind. So the resources that I'm sharing, like the statistics and things, come from very reputable, you know, sources. For instance, you all have probably heard of NEEKC Foundation. And so they recently did a study on Gen Z individuals. It was 1,000 students actually who ranged between ages of 18 through 24, with the average age being 22. It was about half men, half women, but also transgender and non-binary individuals included. So some of the stats and things you'll see throughout that comes from these self-reported surveys. But in general, if we take a glance at the year 2022 and just, you know, individuals were asked like on a given day, on a given month in 2022, what did your days look like? And so 31% of individuals reported that most of their days were bad days. 33% reported that most of their days in 2022 were good. And then we have that 36% reporting neutral days. And so obviously, I'm glad that some individuals reported good, right? I would love for the number of bad days to be reduced, but it just kind of helps us to realize that, you know, when we encounter individuals in the Gen Z population, we don't necessarily know what type of days that they're having or how things are going in their lives. So always, you know, to just be kind, but to take into consideration that they really might be in situations where they need a lot of support. It actually showed that on average, individuals reported having 10 mental health days each month. And I want to also just say, like, when it comes to mental health days, you know, I know we kind of throw that term around more and more in our society. There's no hard and fast definition of what that means. But in general, when it came to these results, it's just individuals who felt like they had to stop their normal activities, whatever that looked like, to kind of focus, you know, predominantly for that day on taking care of their mental health and being in a stable mental space. So on average, 10 days each month to use for, you know, mental health purposes is a lot, and it very much is increased. And so keeping that in mind is important. Again, of individuals who currently have diagnosis for mental illness, they were asked, you know, what diagnosis they currently have. And you can kind of see that anxiety and depression really took the cake here, with 90% of individuals reporting that they were diagnosed with anxiety and 78% reporting depression. And in terms of like working with the college population, you know, Gen Z, this definitely is true. And obviously not to minimize the importance of, you know, paying homage to individuals who do have these diagnoses, but to just also realize that there likely it's other things going on that really makes individuals have such high levels of depression and anxiety, which we kind of touch on in a couple of the later slides. In terms of just talking about mental health in general, individuals really report having different feelings about, just talking about this area. Obviously, depending on the person and the context, they feel more or at least comfortable, but in general, always feeling more comfortable talking to like friends and peers, siblings. That was followed by parents. And in terms of those they are least comfortable with talking to these things about came leaders. That also includes like supervisors, teachers, strangers. And as clinicians, obviously we kind of fit the category of strangers, though we hope that, very quickly we'll get out of that stranger category. The truth of the matter is that we kind of do start at number 2. And then, number 3 was grandparents. So not necessarily comfortable talking about these issues with grandparents, but just knowing that in general, the takeaway is that individuals have different levels of comfort when it comes to, talking about mental concerns. And so oftentimes you'll see people who are kind of reluctant to really talk about these issues. And it's important to also note, especially something that we definitely see over here at Healthy Minds, is that a lot of generational differences, we know they exist, but maybe we don't oftentimes really think a lot about what that does for students. But, for instance, if a student is, a part of Generation Z and maybe is more comfortable with talking about mental health and mental concerns, but then they go home, with individuals who feel like mental health is not real or it's not a legitimate concern. For instance, some students will say that like, all my life, my family has told me that I was like making this all up in my head and nothing was wrong with me. And I just needed to like buckle down and work harder in school. That makes those individuals who might actually have a legitimate mental health concern kind of minimize it or push it, to the back burner and just feel like it's really not a thing. And so it kind of can go both ways. But just keeping in mind that people just may not necessarily be as comfortable talking about these issues right off the bat. So it's really going to be our jobs to kind of make them feel more supported and comfortable to kind of do so. Another thing that is quite interesting is the ways that mental health issues and things are impacting Gen Z population and kind of the workplace. Of course, you have individuals who most of the time in this population are still students, but a lot of them still work, whether it be because they want to, a few of them want to gain that experiential knowledge and that's why they work. But then of course, some people have to work, right, to pay their expenses. And so we see individuals using an increased amount of what they call mental health days. And so this differs from the previous statistic that talked about just in general mental health days for everybody. This one right here kind of pertains to individuals who have jobs who actually gave that as a reason for taking off of work. So it was an average of 3 mental health days in 2022 for these individuals. They are tending to have more increased conversations with leadership staff and being more open about just the mental health concerns that they have and the fact that they kind of need time for themselves to get their mind together, which is definitely a positive shift. But we've also been seeing increases in something called quiet quitting. And so what that looks like is not necessarily what you envision of people like packing up their whole office in a box, walking away like I quit, but instead individuals staying employed, but just making an internal decision to kind of do less and less. And so what happens in those situations is that the person is still employed, making this decision to do less, but it causes frustration with like the leadership and the other employees who feel like they're not cutting, they're picking their weight and doing what they need to do around the office setting, which makes it more, just intense and negative and kind of chaotic. And individuals bring that here. So individuals are talking a lot about how they kind of hate their jobs and don't really want to go back and, are choosing not to do any work, but are not going to tell their bosses how they feel. So I say that to say it just causes a lot of implications, not only in school settings, but also in the work settings as well. Another thing you'll see is individuals really being very fearful about the future. Some students that I work with, they don't necessarily come right out and say, hey, I'm afraid of the future and what that holds for me, though some do. But you'll see it kind of manifested in other ways. For instance, these are some of the areas that they kind of talk about and kind of, you can just see like the anxiety and the fear and things come out of their conversation around these issues. A lot of them have concerns for like finances and being able to, pay for the expenses that can include like the cost of college or paying for mental health appointments, just anything that's related to like, the financial realm. Of course, physical and mental health is a concern, environmental issues. We live in a society where obviously is continuing to be, mass shootings and different things like that. So you see a lot of concern around things like that. But also COVID-19, individuals still worrying about their health and okay, we're not wearing masks anymore, but I have a weak immune system. What should I do? Individuals in my classes are coughing on me. I don't know how to address it with the teacher. So you see lots of different just areas that really are causing them to be quite anxious. And I definitely feel like I would be remiss to do a, presentation on Gen Z without talking about something that's quite important to them, which is technology. As you all probably know, individuals are being exposed, more and more at younger ages, right? And so the average age continues to decrease. Average is 12 years at this time, but 1/5 of individuals who were, selected for participation in a survey reported having access at 10 years or less. And that's pretty young, right? To be exposed to all of these things. But in general, it's sort of like a love-hate relationship you'll see students have because they want to be online, they want to, have these quote unquote connections and things, but it's also causing them to just always be activated and always be on. And it's really taking a toll on just their self-esteem and confidence and things like that. 1/3 of individuals actually posted online regarding like a mental health issue. So that shows that they are like more and more willing to kind of talk about mental health in public platforms, but it's sort of like a double-edged sword because individuals, will tell me all the time, I'm more comfortable with expressing myself online and saying what I feel, but at the same time, that opens the door for people to come at them or negatively ridicule them and call them crazy or openly, discuss in classrooms or in public settings of the campus and things, what that person is going through. So it's sort of a win and a lose at the same time. 57% of those respondents actually said that they had to take a break altogether for mental health reasons, while 1/3 of them actually had to delete accounts in order to keep their mental sanity, they reported. So, some individuals are really taking, steps to really say, I can't be involved in this online things anymore. I don't want to do the technology things anymore, but still, a lot of individuals are still on the apps, are still on the sites. You even have individuals who come into the office and try to use their phones. So I'm sure you all, have experienced that too. So technology continues to be a big thing. And, you would think because of the fact that individuals are quote unquote always connected, that actually increases connections, but this really not the case, to be quite honest, because individuals are more and more developing these relationships that really are not necessarily real relationships. I mean, they can literally be with individuals who are not real or pretending to be somebody else, but oftentimes it's just these connections that they think they have, but they really don't because they are not having the opportunity to interact with real people in the real world and, just develop the skills and things that are needed when you interact with people and have, real communication. You see a lot of students reporting that they feel isolated, actually, even though their followers increases and they have more, friends online, they really are reporting that they feel very lonely. Then you have individuals who, are feeling like they're falling short or not living up to the standards that they should be. These days, if people don't have like a lot of followers or people are not reposting your information or all these things, they feel less than, they feel like they don't have what it takes or something's wrong with them. And I see this all the time in my clients. So that's just like another added on layer of things that we need to be aware of working with clients. Like they do care heavily about not only what people are thinking, in the real world, in their classrooms and people out here, but also online. You're dealing with a whole nother world of things that are impacting them and that they're bringing into the therapy, setting that's from online. Now, Gen Z is often called the most depressed generation. And so within this survey, they really talked about like the differences between generations. And so individuals from different generations were asked like, do you see yourself as having most good days rather than bad? And so Generation Z was actually the generation that was found to have depression at a higher rate than all the other generations. I don't know if that's true or not, but that's kind of what it was found. Baby boomers were actually the ones who reported having the most good days, followed by millennials who reported having 56% of like good days. 51% of Generation Xers, but only 45% of Generation Zers reported that like most of their days were good days as compared to other generations. But I think it's important to also remember that even though, you know, they're sometimes called the most depressed generation, there is a lot of possibilities, you know, that really is available for this generation, because they are willing to engage in these conversations and talk more about what's going on inside. And you don't necessarily see, you know, some of the things we saw in previous generations with them feeling like, you know, what goes on at home stays at home, or we're not willing to talk about our personal issues with, you know, strangers or people that we don't know. Yes, it's a little bit of that reluctance, but it kind of is, you know, they're more open about really just diving into these issues in a safe setting, which definitely leaves a lot of opportunity, space and opportunity really for individuals like us clinicians, because we have like a in, right? We have a way that we can work ourselves in and kind of get them talking about what's going on inside. And again, as we talked about, some of the reasons why Gen Z is so depressed, but I also wanted to talk about sexual identity, which is something that a lot of students, increasing number of students are bringing into, like, for instance, Healthy Minds, and probably a lot of your settings of things that they're really struggling with. So according to a survey by the Trevor Project, which does a lot of work with like transgender individuals, non-binary individuals, a lot of just LGBTQIA resources and things like that, they're pretty great. But they have like a lot of surveys. So this right here is based off the 2022, so the most recent survey data. And actually 36% of these individuals, LGBTQ, have actually been physically threatened or hurt. I won't read all of this, you know, for time purposes, but just in general, you know, individuals are still struggling when it comes to like sexual identity, not only within themselves, but also being ridiculed, mistreated, and assaulted, you know, on college campuses and things like that. So that still is like a big concern. And oftentimes these individuals are really reluctant to get mental health care for a lot of the reasons why other, you know, individuals who are not LGBTQIA are. But in addition, they do have some additional concerns, like them not being taken seriously, or feeling like it's no privacy regarding the things that they discuss, or feeling like they'll be misunderstood, or maybe quote unquote tried to talk out of, you know, being transgender or gay or bisexual or whatever the case may be. So just feeling like they want to get the help that they need, but they feel like they will be encountered with a lot of judgment, which might not necessarily be the case, but that's kind of how they feel based off how they are treated on a day-to-day in a lot of regards. So just keeping in mind that it might take a little bit of extra effort to help make these students kind of feel comfortable in terms of like that mental health conversation. And as I had heard you all talking about before I actually started my presentation, just stigma and some different things you all were mentioning in your case studies, which sounded amazing. I wish I would have heard that. But just in general, you know, stigma obviously continues to be a thing, and it impacts students of all nationalities and colors and races and things like that. But it definitely is the case that it can be sometimes higher in particular groups, especially, you know, for instance, thinking about cultural differences. Some people feel like they're not going to have a clinician who kind of understands their background or their race or identity or where they come from. Individuals still have trouble, you know, accessing particular services, like they can't make it to particular locations and things like that. So that's another barrier. And then also there still are disparities, you know, even in our program. I mean, we have financial assistance and things students can apply for, but a lot of times like students have to get past that barrier of like feeling embarrassed to fill out an application for assistance, or feeling embarrassed to tell me or one of the other clinicians or psychiatrists that they actually are having trouble or something like that. So, you know, if we don't know an issue is there, then we can't really help them there. So just understanding that it impacts us in a lot of ways, because some people have a misconception like, okay, we offer financial assistance. What's the problem? I mean, why are they still not accessing care? Well, you know, do they feel like it's accessible to them? Do they feel comfortable enough to fill out the application? Is it in a way, you know, presented in a way that they can understand? So really trying to, you know, decrease barriers of all kinds is very important. And again, COVID-19, which a lot of this, you know, we already have kind of touched on, but just in general, some of the things we might not really realize is that Generation Z is a generation where COVID really kind of changed the way things look for them. Like, for instance, I have students to this day who like are, you know, 23, 24 and still talking about, man, you know, my brother and sister never got to go to their prom, or even some of my current clients. I didn't get to go to my high school graduation. We did it on Zoom. I never got to go to a prom, you know. We had a celebration on Zoom, things like that. So really feeling like they were cheated out of not only their high school, you know, years, but also like their early college years, because they never really had that interaction. And that's something that they feel a lot of students feel set them back in terms of like being able to make meaningful friendships and things like that. So you see a lot of that sadness and things like that. A lot of them had, you know, loved ones that passed away or took on new roles when it came to siblings. For instance, I have a student, both of her parents, you know, passed away. And so she actually cares for her other 4 siblings, and she's also a college student. So just a lot of things that we might not necessarily realize, you know, have impacted them as a result of COVID, or things that they carry with them each day. And so in studies, more and more, they're really comparing Gen Z and millennials in a lot of ways. So I just felt like it'd be good to kind of set the stage with some of the differences, but also the commonalities in general. Some things I want to highlight really is when it comes to Gen Z, you do see a desire for them to find and create meaning. And I think that's something that's really unique and very interesting about this particular, you know, population of people. They really want to figure out what they're meant to do. And a lot of them have this drive, like you ask them what they want to be in the future, and they're no longer are they like, I want to be, of course, doctor, lawyer, all that's great. And yes, you still get that too, but you see a lot of people, I want to be an influencer, which I won't give my personal opinion about that, but they want to be influencers. They want to own their own businesses. They want to open their own companies, which is great. But, you know, I try to remind them, you got to crawl before you walk, but still they have this drive that's really amazing, right? And really helps them feel like a sense of purpose, meaning, and motivation, which is important, but also trying to help them be realistic in their goals and the way, you know, the steps that they're taking to get to the goals that you're trying to create for themselves is very important. Another thing I just want to highlight is them being more apt to prioritize work and life balance. 38% of Gen Zers actually said that this is one of the main things they will look for in any job that they get now and even in the future, is a job where they're able to not only work, but also be able to create a schedule that works with them having a social life and having a family life. So you see them, you know, taking more of a stance on what kind of is important to them, which I think that's very powerful. So here are just some helpful hints. It's important when working with this population to know that they are used to instant gratification. And I just want to highlight that because as we know, you know, as clinicians, that doesn't always align with how therapy works. Like, it's not like, okay, after 1 or 2 sessions, everything is going to be fine and there's not going to be any type of worries, you know what I mean? So helping them understand from the get-go, being open about your approach and about what therapy looks like, and that there's no magic wand that's going to be waved. Just being very, you know, transparent and upfront is going to be important. Another thing about Gen Z population, they just do not like to be lectured. So that's why I say I really try to mentor and educate them rather than make them feel like they're lectured. For example, instead of saying like, back in my day, I say things like, in my experience, or help them to feel like they, you know, are really the owners of something, saying things like, you'll be the owner of this, or, you know, it's going to be really on you to take hold of this, or, you know, I'm relegating or delegating this particular task to you, making them feel powerful, which they are powerful, definitely, but they definitely want to feel like you feel like they matter and they have a valuable say and their input is really important. So just really going above and beyond to make sure that they feel like a collaborative part of the therapeutic process is really what's going to win them over.
Hey, Brandy, we're about 1 minute left. Just wanted to let you know.
Okay, let's see. I will. Okay, I'll talk about welcoming space. So thank you all so much. I'll end it here. But in terms of creating a welcoming space, I just want to share some of the things that I kind of do when it comes to my approach. Definitely making sure the space is very inviting for them. Considering seating, you know, allowing them to have whatever drinks, snacks they want, you know, within reason, providing digital options if possible, allowing them to, you know, kind of get reminders on their phone, appointments, use their notes on their phone app to be able to stay engaged, or write down activities or things you might give them to do before next session. Don't underestimate the use of disclosure. It's important for you to just be open with them and let them know that you're trying to get to know them, and you don't come in as like the expert that knows, you know, what's best in every area of their life, and really helping them to feel like that you have a genuine, you know, interest and passion on seeing them be successful is really what's going to be important. And I will end it there. Thank you so much.
Thanks, Brandy. No, we really appreciate it for coming, you know, after everything that's gone on. So just real quick before everybody hops off, next session's May 2nd. Be on the lookout for more information on that. We will not be sharing the slides as of this moment because Brandy's got another talk using those slides. So be sure to check out the recording for those. And then if there's anything, questions or any concerns before that next session, please let us know. And we will see everybody in May. All right. Take care.
Thank you.